The liver opens to the eye. We can see because the liver energy enters our eyes. So if our liver chi is weak or it cannot enter our eye, we will not be able to see. All problems with vision are primarily caused by imbalances of the liver, and other organs are associated with different aspects of the eyes, thereby affecting sight as well. Both short and long-sightedness are related to poor function of the eye muscles that operate the lenses and are yang deficient states of the liver. There seems to be more liver in long-sightedness than in short-sightedness. Patients with long-sightedness, or those who could see far, have problems reading in the evenings. They seem to need more light than others, whereas the amount of light does not seem to be an issue in short-sightedness or myopia. So here we could see the tower diagram that corresponds to short-sightedness or myopia. As you can see, the liver yang is deficient. With long-sightedness or hyperopia, the yin is in excess and the liver yang is deficient. Of course, short or long-sightedness could be a chronic problem in patients who have more recent disease states in the liver. Therefore, this should not be the only factor one should consider while making a diagnosis. The illustration of the eye shows the associations between other organs and the eyes, and we should bear in mind that the liver is always affected in eye problems. So let's start with the cornea. The cornea, sclera, and conjunctiva are like the skin of the eye. They are therefore associated with the lung. And dryness, astigmatism, and problems that are similar to dry skin, lung yin deficiency, or even liver yin deficiency. Conjunctivitis and itching of the eyes is common in hay fever. Symptoms associated with wind heat in the lung, similar changes of irritation, sweating, sneezing, and runny nose are present in the respiratory system as well. Now let's talk about the iris. So I hope you remember where the iris is located in our eye diagnosis. So actually the iris is the colored portion of the eye. This is a muscle that widens. So look at it as the shutter of the camera that widens and contracts to let light in or keep it out. So the iris, there's an opening there called the pupil, which widens to let the light in and which contracts to keep the light out. If the function of the iris is good, it will move quickly. So this will enable us to adjust quickly to changes in light. If functional chi is deficient, the iris reflex slows down and adaptation to light changes takes much longer. So a person is temporarily blinded when coming into a bright area, or takes much longer to see clearly when going into a dark room. Iritis is a young access of the liver, and following recent recurrent inflammation, there could be yin deficiency, and the iris becomes contracted and has difficulty expanding. The medial canthus is related to the heart. It is red and irritated in a yang dominant state of the heart, the redness spreading to the white of the sclera. In yin states, it is so the medial canthus would be pale or grayish, and it has a sunken appearance. The pupil, the lens, and the vitreous body. These are governed by the kidneys. Cataract and turbidity of the vitreous body indicate concentration of fluid, a dryness of the kidney, and of course, liver yin. Glaucoma or increased eye pressure indicates stagnation of fluid. So there is yin stagnation in kidney and liver. The upper and lower eyelids are related to the spleen. When spleen function is deficient and it does not circulate fluid to the periphery, the patients have edema in the hands, feet, tongue, and in the eyelids. And in the case of gastritis or hyperacidity in the stomach, it is possible that the eyes have a red eyeliner type appearance.